The Rural Health Association of Utah, the mission and vision is really to improve access to equitable care for healthcare in rural Utah. For me, what really brought me into this is I'm from rural Utah. I grew up in Tropic, Utah. We had a clinic that was open a couple hours twice a week, or otherwise we had to drive 30 minutes to get just a primary care appointment. And any specialty care was 2.5, 3 hour minimum drive to get to a lot of specialty care. And coming from rural, I have a little bit of the underdog syndrome, I think. We're not used to getting resources. We're not used to getting attention. So you fight for everything that you have. And it's personal. I'm fighting for that access, and I've lived through that. When I was in high school, there was one cell phone company that had towers in Tropic. Technology was lagging that far behind in rural Utah. We are late adopters. We do things a certain way, and we sometimes are quite resistant to change. I still get stuck in my paper ways sometimes. And, I know that I'm doing things that take me 2 or 3 times longer than they should because it's how I know how to do them. It's not because there's not a better way, it's how I know how to do them. What I want people to gain from coming to this conference is it's a really unique chance to take a look at how we do things and try to overcome some of the barriers rural healthcare has had in America that we just haven't been able to get through. Utah will get just south of $1 billion over 5 years. And we're talking things like interoperability, telehealth, electronic health records, revenue cycle management, things like that we're trying to accomplish with this funding. From a healthcare professional side, you're coming at it from we have a problem. What are some of the solutions maybe I don't know about? Or some of the technologies that have been developed that I don't know how to implement, how they could help me? From the technology side, it's a good chance to come in and really understand from the rural healthcare perspective what it is that they need. One of the key things that we're trying to do here is bring the tech industry and the healthcare industry together so that those rural leaders in Utah can share with the tech companies where their pain points are, what they're struggling with, what they really need to be more efficient. The entire purpose of the conference is meant to convene rural healthcare and technology to foster a shared vision of how to move forward together. If you come to this event, it's going to help you learn how to do things in new ways that are going to make things super efficient, much faster for you, and it may eliminate some of those processes that you just dread doing. You may not know what you don't know, and you may miss huge opportunities that would make a significant difference in your facility. So you don't want to miss this because you don't want to miss out on this information, on this discussion, and get left out while everybody else moves forward without you.